Hi, I'm Dr. Biter. Today I'm here with a patient that has chipped their tooth. They did that while they were eating something, front tooth on the bottom, and we're going to repair that. We're going to use the laser, and we should not need to numb him. So we'll do this without anesthetic and get a great outcome. Alright, so we got all done, and as we got into this, we noticed that on the tooth next to it there was a filling that was deteriorating and breaking down a little bit, so we decided to just go ahead and replace that filling. So we did. We replaced that filling and we fixed the tooth that was chipped. And how did that go for you?
Terrific. Slick, easy, painless. It was marvelous. I can't believe you did all that without any anesthetic or anything.
All right.
That's amazing to me that you would take care of that filling at the same time. Thank you so much.
You're welcome. Yeah, so we took out the filling, no anesthetic, did that with the laser. Got the new tooth, or the new areas ready with the laser, and went really slick.